Honored to have with us Dr. Danny Heller. Danny, my sister lives in New York City, so I wanted to reach out to you to see exactly the situation in New York City. We hear from politicians, we hear from media experts. I wanted to reach out to a doctor that's in the front lines, that's dealing with all this. Can you talk to us about the last couple of weeks and days for you?
Sure. So I'm an acute care surgeon in private practice. I work out of a few hospitals, 3 different hospitals here in New York. I'm the chairman of surgery at Mercy Medical Center in Rockville Center in Long Island. Over the last couple of weeks, as every hospital has been, we've seen a surge in critically ill patients. The hospitals are 90–95%, if not more, COVID patients. So it used to be a couple of weeks ago where there were a few COVID patients in isolation. Now almost the entire hospital has been changed over to COVID-only patients. In the first couple of weeks, we just saw sick people coming in, and we put them on the ventilators, and we tried to support them through these difficult times in their lives. Unfortunately, over the last week, we've seen an increased number of deaths. Every hospital, depending on how many COVID intubated sick patients they have different numbers of deaths. In 3 days, I saw over 20 deaths for me, but in other hospitals, there's been 20 deaths in a day.
Danny, what do you say to the people that are still in New York City, in LA, in different parts of the country, still going around like if everything's fine? There's churches that are packed in some places. There's parks in New York City. My sister sent me a video where people are still congregating, still together. What message, you that are seeing these number of deaths, what message can you give everyone?
We have very strong HIPAA laws, which prevents us from discussing the nature of what goes on in the hospitals from patient to patient. But if there were no HIPAA laws and recording crews were allowed to come into the hospital to see what's going on, and if that was published on the air, the amount of patients, the amount of sick patients, the number of deaths, the refrigerator trucks outside the hospitals that are just for the bodies that they can't accommodate in the morgue, I can't imagine that people outside would still be doing the same things and not taking this seriously. When I had to call 10 families in one day to tell them that their loved ones had died, and they were not allowed to come into the hospital to visit or to see them, and the best they can do is just call their funeral home and have them prepare and pick up the body, it is staggering. The screaming on the other end of the phone from families that their loved ones came into the hospital just a couple of days ago, and now they're dead with very little information, without contact, without being able to come in to see them. And these numbers of deaths are just going up. And I can't imagine that if people actually knew what was going on inside the hospitals, they would continue to be so careless outside the hospitals with their health and the health of people that are around them.
Are you seeing regular patients for other illnesses or strictly working on COVID patients?
So right now we are strictly working on COVID patients. Most of my patients have breathing tubes. We are stretched thin. I would probably say the only reason why we haven't run out of ventilators is because people have been dying, which frees a ventilator up for a new person who needs one. We're running out of all of our medications. Typically, we give certain sedatives to keep people asleep when they're on the ventilator. We're running out of all of them. We have meetings every day about what our supply is like, and some days we have a 2-day supply of a given medication. So we have to find alternatives to these sedatives and to these other medications that typically are being used. We're running out of certain equipment. We're running out of something called a central line, which is a large IV, which goes in the neck that allows multiple simultaneous infusions of medications. We were told by the hospital a few days ago that we have 4 left in stock. So again, every hospital is dealing with their own supply chain issues, but the common thread is that we're running out of medications, we're running out of equipment, and we are definitely running out of nursing staff and doctors. Some nurses in ICU are used to taking care of 2–3 patients maximum. Some of my nurses now are taking care of 7 or 8. We don't have enough staff, and we're running thin. And the staff that we have is getting tired.
I wish I could speak to you in a much better situation, a greater time in our world, but I'm really appreciative of this conversation with you. How much longer, in your personal opinion, do you think this lockdown, this virus, will continue to affect all of us?
So I don't believe we've seen the peak yet in New York. I think we will peak probably in the next week or two, maybe. It all depends on the safe practices people have in the community. Again, there are people out there in the community that even if they're safe now, if they weren't safe 2 weeks ago, they could become symptomatic shortly. So we haven't peaked. We're still seeing an increase in death rates in the hospitals that I'm working in. And I think it may be a month or 2 months before this starts to calm down. In terms of social interactions, we could be looking at 6 months, 8 months, a year plus until people feel comfortable, until I feel comfortable going out into the community without a mask, without gloves, feeling that I can be safe. And I think what's going to really be the determination is not the medications that we are currently using to try to augment and support people that are very sick, but it's going to be the vaccine. Once we have a vaccine and people can be sure that we vaccinated a certain percentage of the population that they won't get sick, only then, I believe, will people feel comfortable going back to the daily social interactions.
Dr. Heller, when do you expect stadiums being filled with 70,000 people for a football game, 20,000 for a basketball game? The NBA is thinking about starting up again. So is the NFL saying they want to start again in September. Do you think it's possible September, brand new stadium here in LA is packed with 70,000 people?
I think towards the beginning of this or the middle of the summer, we'll have a better understanding as to how we're handling the virus, what new treatments or even vaccines are on the verge of coming out to be able to tell where we're going to be in the fall.
Thank you so much, Dr. Danny Heller, in New York City, fighting the fight. Thank you to you. God bless you, your nurses, your staff, and everyone there. Is there any bright side to the situation right now, to the treatment? Can we end this interview on a positive note some way, somehow, Dr. Danny Heller?
I almost felt on day 2 that I was giving a Independence Day speech from that movie, We Will Not Go Silently Into the Night. I stood up there at the nursing station and I spoke to 15 or 20 nurses and I explained to them that I don't expect you to feel comfortable with what's going on. This is not normal for your day-to-day healthcare in a hospital. This is a surreal event, and I told them that whatever support they need, they should come to me. If you don't feel comfortable managing a ventilator, you come to me and I will educate you and I will help you feel comfortable. And if I can't be there all the time, I will get someone who will be able to make you feel comfortable. So my Independence Day speech worked. We were able to get all the nursing staff involved, get them to feel like they were supported in these times where they're doing things which are above the scope of their daily practice. Since then, we've turned our regular unit into a full functioning ICU in less than 10 days, capable of every room supporting hemodialysis, supporting critically ill patients on ventilators with HEPA filters in every room in order to decrease the exposure of staff to the virus when they come into the room. Because as you come into the room, every time you are potentially exposed to the droplets that are being forced into the air. So we've turned units into ICUs that no one ever thought would have been. I have to salute the nurses who stepped up, that were not just the nurses and the other allied staff that stepped up to help out in times where we know they're needed, they know they're needed, and this is beyond their scope of practice, but they're doing such an amazing job. And I'm so thankful to the people that I'm working with, because without them, there is no way we can treat and help the current numbers of patients that we're seeing that are critically ill. We went into this business, all of us in healthcare, to help people, and we are certainly doing that, even if it means risking potentially our own lives. We are out there, we are helping people, and I hope we are making a difference.
You're 100% making a difference. Dr. Danny Heller, thank you so much, sir.
Thank you.
Dr. Danny Heller, thank you so much for coming on the Pablo Show and sharing your point of view from New York State.
Thank you. Be well, stay safe.